Welcome back to Dr. Arshad Nadimawan Ultrasound and Radiology teaching video. I do hope that you will all be enjoying your life and you will all be very happy with your 2024 new year. And you must be having something in your hand to specially and particularly do in this year. I'm going to talk about the calcification, microcalcification, which are very important as far as mammogram is concerned. And when you're reporting mammogram, you may come across with microcalcification, either benign or malignant. In the previous images, in the previous video, I have discussed about the benign microcalcification. Today, I'm gonna discuss about the malignant calcification, like high histology grade ductal carcinoma in situ will give rise to a comedo calcification, or may call it as a casting calcification, and low histology grade ductal carcinoma in situ. This will give rise to a cribriform pattern, how it will appear on the mammogram images. And beside this, you have to keep in mind that when there is increase or the greater the number of the fleeks within the image, so that is a likely possibility there will be a malignancy. And if it is less than five calcification in per centimeter, so there is less chance of getting the malignancy. And always remember that the malignant calcification is usually less than 0.5 mm. So how it will appear on the ultrasound and on the mammogram images? Let's start watching these images.
Many breast cancers arise from areas of ductal carcinoma in situ and are associated with macrocalcifications on mammography, particularly true for high grade invasive ductal carcinoma associated with high grade ductal carcinoma in situ. So, there will be malignant microcalcifications. Microcalcifications are more likely to be malignant if they are clustered, vary in size and shape. If it is vary in size and shape, you can use the word of pleomorphic, or found in a ductal or linear distribution. So think of malignant microcalcification. The first important is a high histological grade, that is ductal carcinoma in situ. It is called as a casting, or it's called as comedo microcalcification. Here on this particular image of mammogram, you can appreciate casting or comedo microcalcification. These calcifications are classically linear, fragmented, and rod shaped. Here these three characteristics is visible, and beside this it would be branching. So these comedo or casting microcalcification represent calcified necrotic debris within duct, hence they are linear and branching in structure. That is the only reason. And the greater the number of microcalcifications, this would be associated, specially associated with ductal carcinoma in situ, the greater the risk of invasive disease. So this is one of the worth noting point, that the greater the number of the microcalcification flakes would be, that would show that there is a great risk of invasive disease. Here on this image again you can appreciate that these are fragmented, these are linear, these may be rod shape, and the second thing, these are all branching. This is characteristic of high histological grade of ductal carcinoma in situ, and this would be called as casting calcification, or you may also use the word for that, that is comedo calcification. So these calcifications are high histological grade, and these are highly malignant and especially seen in ductal carcinoma in situ. Another slight and magnified view for you to understand that these are rod shape, these are branching, and these are all fragmented. So if you come across such type of calcification, must think of malignancy, and this usually arise from the ductal carcinoma in situ, and these are high histological grade. So high histological grade calcification will appear as fragmented, rod shaped and branching, and would be usually seen in ductal carcinoma in situ. Now come the next point. There is mainly two types of malignant microcalcification, the one with the high histological grade and the second is a low histological grade. So this is what you can appreciate on this image. This is craniocaudal view and this is microcalcification, but this calcification has low histological grade. So microcalcification are much less frequent as there is usually no intraductal necrosis and it will appear as a cribriform pattern. So here you can appreciate a cribriform pattern when they presented or they are clustered in appearance, but otherwise the appearance would be non-specific. So that is called as cribriform, or this is basically a low histological grade and can also be seen in ductal carcinoma in situ. So here again another example for you to understand calcification of low histological grade. So this will appear as an cribriform. So cribriform pattern is there. This is actually non-specific, but still you may be able to see all that thing, and this is what we call is as a low histological grade ductal cell carcinoma or ductal carcinoma in situ. So this is very useful information. I do hope that you will love that. Here on this image again you can appreciate the cribriform pattern, and this is low histological grade ductal cell carcinoma. Some of the point are worth noting, like the greater the number of the fleeks of microcalcification, it would be associated with area of ductal cell or ductal carcinoma in situ, the greater would be the chance of invasive disease. So mind you, less than 5 calcification per centimeter have a low probability for the malignancy, and malignant calcification are usually less than 0.5 mm. Very rarely you would be able to see more than 1 millimeter. And another last point that you must keep in mind, that the sensitivity of ultrasound for detecting the ductal cell carcinoma is significantly lower than mammography. So therefore ultrasound is not a good modality of it should not be used as a good tool, screening tool for the detection of the malignancy and especially for the detection of the microcalcification. However, if you are expert enough, you may be able to see the calcification and you may raise the concern. But as a tool, we are not recommending to use the ultrasonography for the confirmation of the presence or absence of the microcalcification. The only tool that you have is the mammogram, and there are some two standard views of the mammogram, MLO and CC, and beside this you need to have some standard so you need to have some extra views or supplemented view, like you need to have a magnifying views, a true lateral view, so pedal view. So this will help you to identify these calcification in a exact way or in a correct way. Yeah.